Dr. Marzell is a primary care physician that combines the wisdom of natural medicine with modern medicine to help facilitate the body's inherent ability to restore and maintain optimal health. She focuses on evidence-based nutritional therapy for food allergies and in bioidentical hormone replacement. She is a twice published author, a long-standing member of the North American Menopause Society, and a certified menopause practitioner. We are on a mission to empower you with the knowledge and expertise that Dr. Marzell has earned throughout her career. We hope you enjoy and want to thank you for being with us today. Without further ado, here's Dr. Marzell. Enjoy the show.
Hi, this is Dr. Lori Marzell. I would like to talk a little bit about hormone replacement therapy. I do a subspecialty in this area, and I'm a licensed physician in the state of Oregon. Today I would like to talk about the differences in hormones. And this will be an estrogen versus progesterone. Which hormone is appropriate for you talk. Now, one of the most common mistakes that I see when people come into my office in using hormone replacement therapy is picking the wrong hormone. And the two major hormones involved in women's physiology, sex hormones, are estrogen and progesterone. So let's talk about that for a while. I guess I'd like to call this talk Progesterone Talk number 1 or something, because I have a lot to say about this. First of all, it's important to understand that estrogen and progesterone have different functions in the body. It's kind of like yin and yang. They balance each other out, as most functions in the body do. Most functions have some kind of balancing so that one doesn't produce effects. It makes sense. Anyways, the important point to make is estrogen is what starts changing menstrual cycles in perimenopause. Estrogen lack starts making it difficult for the body to ovulate regularly. And the final phase of menopause is pretty much estrogen dysfunction, lack and dysfunction. So if hormones were wearing cowboy hats, this is the way I'd put it. Estrogen would be the guy with the white hat. For those of you who don't know about the old cowboy movies, where you could always tell the bad guys because they were wearing a black hat, and the good guys had a white hat. Well, progesterone I would give a black hat to progesterone. However, many practitioners, when women are in perimenopause or when they are even in menopause, give women a disproportionate amount of progesterone or nothing but progesterone. I have been actually shocked at seeing how often this happens. So let me tell you a little bit about how the body works. It's important, if you're looking at therapy for the body not working, to look back when the body was working. How did it work, and what can we do to try and help it to work again? So if you were having your regular menstrual cycles and you were not in perimenopause or menopause, the way it would go is this. At day 1, which is the first day of your period, you would be you would have a low amount of estrogen, and you would be starting to produce your own estrogen, and it would go up, up, up to about the mid-cycle, about day 12 to 14, and then the ovary would be growing an egg. The egg would break through, and ovulation would occur. Now, progesterone, during this period of time, is not being produced by the ovary. And not in any, perhaps they'll find some micro amount of it, but really not, for all intents and purposes, it isn't being produced. When progesterone starts being produced is after ovulation occurs. I can tell you this because the place that produces it is the little housing unit where the egg was growing. It turns into a progesterone factory. When that happens, progesterone surges into the body, and it lasts for a very limited period of time, and it's always the same amount of time for every woman, 12 days. This is why you can, when you have your period, you can look back 14 days, because usually 2 days after that progesterone drops at the end of that 12-day time frame, 2 days later is usually when the period starts. So if you look back from the start of your period, 14 days, you can kind of get an idea where ovulation occurred, no matter what kind of irregular or weird periods and cycles you have. Anyway, so when we're looking at helping women to give them hormone support, why on earth would you give women progesterone throughout the entire cycle? And I'll explain in menopause why you might want to do that. But if they were in perimenopause and they were, the deal is it's an estrogen deficiency, not a progesterone deficiency. You only have, at maximum, progesterone for 12 days of the month. Now, what's the difference? Well, let me tell you a little basic things about estrogen and progesterone. Well, estrogen, being the white hat guys, is something that kind of peps you up. It makes you feel good. It helps your brain become sharp and focused. It helps your mood to be good. It actually produces serotonin in the gut, so it's an antidepressant type of hormone. It helps your bones. It's a very strong antioxidant. It helps you not to have joint pain or stiffness and achiness in your muscles. And it helps prevent heart disease. And it helps all your sexual organs function well. Okay, now what about progesterone? Progesterone's role is to prepare you for pregnancy. So what it does, remember that it starts surging in mid-cycle for 12 days. So if you have trouble with PMS the week before your period, that is when your estrogen is naturally at its lowest level and progesterone is extremely high. You may have noticed a week before your cycle that you're puffy, bloated, you don't feel real gung-ho, you want to kind of sit around, eat chocolate, your appetite increases because you might be getting pregnant. This is what progesterone's thinking. So you need to eat extra food. It actually works on the gut to suck up every possible calorie that you can because the baby may need nutrition. It helps you slow down so that you won't waste a lot of energy, so you can store it up to deal with your pregnancy. It helps stimulate breasts so that your breasts can because you want to feed the baby. So what happens if you take nothing but progesterone? For, let's say you are in perimenopause or even menopause. I've seen this in menopause, where someone just gives you nothing but progesterone. You're going to gain weight. You could be puffy, bloaty. You could have a lot of breast enlargement. Your appetite could be out of control. Your moods might be depressed. So which hormone do you want to have? You want progesterone. The good thing that it does, estrogen will build up lining in your uterus. Progesterone will loosen the lining to make little passageways so that the baby will be fed. And if you do not get pregnant, that makes the lining loose so that when you drop your progesterone level, that loose tissue will slough, and that keeps the tissue in your uterine lining thin and healthy. Now, you do want thin and healthy tissue in your uterine lining, because if one thing grows with no check force, that's where cancer can occur, or bleeding problems. So if you are in menopause and you are taking estrogen every day, you need some kind of balancing act, and you need progesterone. There was an introduction to therapies many years ago that women don't want to continue to have periods, so let's give them progesterone every day. And if you give them progesterone every day, it should oppose the stimulation in the uterus from the estrogen. They can take their estrogen every day. They will protect their uterus by taking progesterone every day, and they will not have to have periods because there'll be no buildup of lining. And that is the way that we treat most women in menopause now. However, sometimes that progesterone is just not enough, and it's good to have a few periods to clean things out. But that's the reason why we give both of them together. However, I can't say how many cases I've seen where women, even women that don't even have a uterus, are giving. I had one woman come in, and she had been in menopause for at least a year or two. She was working with a practitioner who gave her the normal amount of progesterone to give to balance estrogen every day is 100 milligrams. This practitioner gave this patient 200 milligrams of progesterone. She was taking that daily and no estrogen. She had gained 40 pounds, was depressed, still having sleep disturbances, hot flashes, just could not lose weight, and was a mess. She's on the wrong hormones. There was no reason for that. And when I see a woman who has had a hysterectomy and doesn't need hormone protection from progesterone for that uterus, it's gone. And they're given progesterone, particularly progesterone at high doses. It's just a recipe for tragedy. One case was recently, it wasn't my case that I saw, but someone else saw, a woman who went through menopause and she gained up to 100 pounds. Her whole body started falling apart. Progesterone is not a good thing to take if you do not need to take it. Well, I've talked for over 10 minutes. And stay tuned for even more thrilling and exciting little podcasts to come.
Thank you so much for listening. If you enjoyed today's content, please feel free to share with a friend and help us spread our message. If you'd like to learn more about Dr. Marzell, please visit our website at www.drmarzell.com. Until next time.